What's going on, guys? It's Dr. Casey from the Lacey location. Today I got my patient Mike in with me. Mike, thank you so much for being in the video. We appreciate it. So Mike's got some pretty unique shoulder pain going on. It's been kind of nagging him for a couple weeks now, almost a month. He's got a history of baseball, and he's a righty. So a lot of wear and tear on the shoulder over the years since he's been growing up. He's a big power lifter. He does a lot of overhead lifts, power lifts. And he's also been mixing in a little bit of CrossFit. So definitely some unique motions from a biomechanical standpoint. So what I'm going to do today is basically show you kind of what we do on a visit to relieve some of that pain and what I'm doing in tandem with the physical therapy to get him at his best. All right, guys. So first of all, Mike's shoulder pain is located totally posteriorly in the shoulder. So right around this area on top of two muscles called the teres mitor and the infraspinatus muscle. So before I go ahead and do some invasive cupping, I'm just going to release some of those muscles around there. He finds his pain with pull-ups predominantly. So in motions where he's using his lat, his subscap, a lot of those pulling muscles underneath the armpit in here. So I'm going to show you how I release those muscles first, and then we'll get on with the cupping. So basically, Mike, we're just going to bring this arm here. I'm going to be digging into your armpit here. This is the subscap first. Arms coming all the way down and slowly up this way. And I'm just going to do, 3 or 4 passes of this. I can feel that muscle is pretty tight. And my goal is just to kind of release some of the tension on that muscle, increase the mobility, so we can go ahead with our next maneuver a little bit smoother. Good. Now what we're going to do, you're going to come down this way. Do an overhead press like that. Gotcha. Go ahead. Good. Good. And we'll do 2 more. Last one. Good. And relax. All right, guys. So now I'm going to show you how we go about doing the cupping therapy on Mike's shoulder. Anytime we're doing cupping, we want to make sure we're doing our cupping in a motion where we provoke the pain that the patient's having. So in this situation, like I said, he has pain with pull-ups. So to the best of our ability, we're going to mimic that motion while we have these cups on. So the cups are basically like a simple suction cup. And what they do is they allow a top layer of the muscle called the fascia to move a little bit more freely on those muscles that are bothering him to increase his mobility, increase his function, and hopefully decrease his pain. So I'll show you how we put this 4th one on here. Basically, all we do is get that cup reversed. I'm going to place it over top that shoulder there. And just like that, it's nice and, tight to the shoulder. So what we're going to do is we're going to mimic that pull-up motion. So Mike, I'm going to have you grab this band here. There you go. And I'm going to create some tension. And I'm just going to have you pull down. We'll do that 8 or 10 times, all right? If anything's uncomfortable, just let me know. Good. Good. And we can see, we're totally activating all those muscles on that posterior shoulder and those lats. And really, this is where he feels most of that pain. So hopefully, sometimes even after we take these cups off and we do the motion again, we'll have a decrease in pain. And 1 more. Good. All right, guys, so lastly, I'm going to show you guys a little adjustment to the upper back region, the upper thoracic region. Sometimes it gets overlooked that with shoulder issues, if we have pain with motion, it's important to also gain some motion in that upper thoracic region. Basically, any shoulder motion also incorporates extension of that area. So it's important in patients like this that we clear that area and make sure they're able to extend through those joints in that area. So that's what I'm going to do with an adjustment here today for Mike. All I'm going to have you do, good, you got those arms dropped, you just relax. I'll have you take a nice deep breath in and let it all out. Good. There it is. Good. All right, guys, so I think it's important to know that in addition to some of this mobility work that I'm doing with Mike, in a situation like this, it's also important to strengthen the area. So we do have Mike doing some PT to strengthen some of those deeper rotator cuff muscles. And combining that PT and that chiro in a situation like this is basically ideal for getting him back on the right track as soon as possible. Mike, I want to thank you for joining us, being in the video. Thank you guys for watching. We really appreciate it. We hope learned a little bit of something and kind of got a little more information on this one. So we really appreciate you. Have a great day.